Oscimin Sr., also known as hyoscyamine, is used to treat various stomach and intestinal issues such as cramps and irritable bowel syndrome. It can also be used to address bladder and bowel control problems, cramping pain caused by kidney stones and gallstones, and Parkinson's disease. Additionally, it can help decrease the side effects of certain medications and insecticides. This medication works by decreasing acid production in the stomach, slowing down the natural movements of the gut, and relaxing muscles in many organs such as the stomach, intestines, bladder, kidney, and gallbladder. It also lessens the amount of certain body fluids such as saliva and sweat. The typical daily dosage is determined by your doctor, and it is best to take Oscimin Sr. on an empty stomach, usually 30 minutes to 1 hour before meals. When taking Oscimin Sr., make sure to follow your doctor's instructions. You should take this medication by mouth, usually every 12 hours. Swallow the extended-release capsules whole and do not crush or chew them, as this can increase the risk of side effects. The dosage will depend on your medical condition and response to treatment, so do not increase your dose without consulting your doctor. Adults and children 12 years and older should not take more than 1.5 milligrams in 24 hours. It's important to note that antacids may interfere with the absorption of this medication, so be sure to ask your doctor or pharmacist for more information. Additionally, make sure to drink plenty of fluids unless your doctor directs you otherwise, and inform your doctor if your condition lasts or gets worse. Some common side effects of Oscimin Sr. include dizziness, drowsiness, blurred vision, dry mouth, headache, trouble sleeping, constipation, flushing, dry skin, and decreased sweating. If any of these effects persist or worsen, it is important to notify your doctor or pharmacist right away. To relieve dry mouth, you can try sucking on sugarless hard candy or ice chips, chewing sugarless gum, drinking water, or using a saliva substitute. You may notice an empty medication shell in your stool, but this is harmless. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks. Many people using this medication do not experience serious side effects. However, it's important to contact your doctor immediately if you experience any serious side effects, such as mental/mood changes, fast/irregular heartbeat, difficulty urinating, decreased sexual ability, loss of coordination, trouble speaking, or vomiting. Seek medical help right away if you experience very serious side effects like eye pain/swelling/redness or vision changes. While it is rare, a serious allergic reaction to this drug is possible. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. Before taking Oscimin Sr., tell your doctor or pharmacist if you are allergic to hyoscyamine, atropine, or any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other problems. Before using this medication, tell your doctor or pharmacist your medical history, especially if you have a history of glaucoma, enlarged prostate, urinary blockage problems, certain stomach or intestinal problems, overactive thyroid, heart problems, high blood pressure, kidney disease, heartburn problems, certain nervous system problems, or myasthenia gravis. If you wear contact lenses, you may need to use wetting eye drops since this medication can cause dry eyes. Oscimin Sr. may cause dizziness, drowsiness, or blurred vision. Avoid alcohol or marijuana, which can make these symptoms worse. Do not drive or use machinery until you can do so safely. Limit alcoholic beverages. Before having surgery, inform your doctor about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. This medication may increase the risk of heatstroke due to decreased sweating. Avoid becoming overheated in hot weather, saunas, and during exercise or other strenuous activity. Older adults may be more sensitive to the side effects of Oscimin Sr., especially confusion, drowsiness, unusual excitement, constipation, and difficulty urinating. This can increase the risk of falling. Children may also be more sensitive to the side effects of this medication. During pregnancy, Oscimin Sr. should only be used when clearly needed. Discuss the risks and benefits with your doctor. This drug passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of how Oscimin Sr. may interact with other medications and products. Some products that may interact with this drug include certain azole antifungal drugs, bisphosphonate drugs, corticosteroids, digoxin, potassium tablets/capsules, and pramlintide. Additionally, if you are taking other products that cause drowsiness such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines, it's important to let your doctor or pharmacist know. Also, check the labels on all your medicines, as they may contain ingredients that cause drowsiness. It's also important to be aware that this medication may interfere with certain lab tests, so make sure lab personnel and all your doctors know you use this drug. Always consult with your doctor or pharmacist before starting, stopping, or changing the dosage of any medications. If someone has taken too much Oscimin Sr. and is experiencing severe symptoms like fainting or difficulty breathing, it's important to call for emergency help right away. In the US, you can call 911 or the Poison Control Center at 1-800-222-1222. Canadian residents can reach out to their provincial poison control center. Symptoms of an overdose may include hot and dry skin, fever, unusual excitement, fast or irregular heartbeat, and seizures. If you or someone you know is experiencing these symptoms, seek help immediately. It is important not to share Oscimin Sr. with others. When taking this medication, it may be beneficial to make lifestyle changes such as participating in stress reduction programs, engaging in regular exercise, quitting smoking, and making dietary changes. These changes can help increase the effectiveness of Oscimin Sr. It is recommended to consult with your doctor or pharmacist to discuss any lifestyle changes that may benefit you. If a dose of Oscimin Sr. is missed, it should be taken as soon as remembered. However, if it is close to the time of the next scheduled dose, the missed dose should be skipped. It is important not to take a double dose to make up for the missed one. Oscimin Sr. should be taken at the regular time as prescribed by your healthcare provider. You should store Oscimin Sr. at room temperature, away from light and moisture. It's important not to store it in the bathroom and keep it out of reach of children and pets. When it's expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do this. Remember not to flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.